95% of residents who are currently in the long-term care homes are diagnosed with dementia. So I find it's very crucial for the PSWs or any nursing staff to have education how to communicate, because that's the part we always miss. Every day we come in and do our focus on our job, but we never communicate with the residents what their needs are.
Knowing how to approach situations, how to assess a room to make sure that you're interacting appropriately with the individual.
I don't think there is a lot of communication in the PSW course.
When I first went into the BEPIC program, I was a little nervous only because of the fact I've never touched virtual reality before, and that was a whole new world for me. But then once I got engaged into the program, I was realized that there was different language techniques that I was utilizing that maybe I shouldn't be.
Hi, James. How are you? I remember my heart was racing when I was interacting with the avatar. It was also that moment of, wow.
This is almost a whole new world for education, which I think is fantastic.
Hi, James. I'm your care provider.
Very simple to use, and they walked you right through the process.
It's a 360 interactive space that you can pretty much turn your head, and it's just like turning your own head and seeing the details within the program.
James, do you mean hockey game?
Oh, yes, hockey, yes.
It was so interactive, and you got feedback in the moment. More than just role playing, you could see how responses or what you said or what you did was effective or not.
In the VR world, it was easier to see and correct yourself.
Is this your grandchildren? It will train your brain to think twice.
I would say the biggest takeaway is how much fun it was, how engaging it was to learn to slow down and allow those individuals to answer.
This is going to develop the communication and the trust and relationship between the residents and staff.
So if they're able to learn tips and body language and ways of key phrasing to simplify the interactions with their residents, they're able to get the job done in a meaningful way. Most of our education's online, so this would be a great, cost-effective way to reach many of our PSWs.
If I have an option to choose between a classroom or a VR, I would definitely prefer VR.
So for someone who hadn't taken it yet, I would definitely recommend it. I think it's a wonderful program that someone should experience, and to be able to say that they had an opportunity to, and that they might learn something that they can bring back to the group.